Welcome to the Medcurity podcast. Today we are exploring a topic that touches nearly every healthcare organization, and this is going to be legacy systems. Now, these are the tools and the processes that many of us still rely on, even if they were cutting edge years and years ago. They include outdated electronic health records, unsupported software, aging hardware, and believe it or not, these paper-based systems and fax machines. While these methods might seem familiar and reliable, they can introduce vulnerabilities that put patient data and HIPAA compliance at risk. Now let's start by looking at our electronic systems. Many healthcare organizations still run on versions of EHR software that are no longer supported by their vendors. In some cases, these systems have become outdated to the point where they no longer receive regular security updates. When a system stops getting patches, it becomes an open door for attackers. The vulnerabilities in such software are well documented, and without updates, there's little to stop someone from exploiting those weaknesses to access sensitive patient information. Now, this challenge isn't just about the software itself, it's about the entire IT infrastructure. Aging servers, network equipment that hasn't been replaced in years, and even medical devices like infusion pumps or imaging equipment can be running software that was designed for a different era. These devices may have default passwords or use protocols that are no longer considered secure, making them potential entry points for cybercriminals. At the same time, many organizations still lean heavily on paper-based processes. Despite the move toward digital records, paper continues to be used in many administrative and even clinical settings. Patient charts might be printed out, fax machines are still in operation, and even today, a significant percentage of patient information is transmitted via fax. While faxing is a long-standing practice and is technically considered secure when proper measures are in place, human error can easily disrupt that security. There was an incident where over this 3-month period, patient details were repeatedly sent to an incorrect fax number, and this wasn't a single slip-up. It was a recurring error that exposed sensitive information multiple times at this healthcare trust in the UK. Now, such incidents will remind us that no matter how reliable a method seems to be, if the process isn't managed carefully, it can lead to data breaches just as easily as a modern cyber attack. Now, the reasons for continuing to use these legacy systems are complex. For many healthcare providers, especially those with limited budgets or smaller IT teams, upgrading can feel like a monumental task. Modernizing an entire IT infrastructure or even converting paper records to digital formats requires significant investment in time, money, and training. In many cases, the old systems seem to work in the sense that they support daily operations and the risk of a catastrophic breach feels remote. However, the reality is that both outdated electronic systems and paper-based processes can result in serious security gaps. The fact that these systems have been in place for years means that vulnerabilities have accumulated, and if an unforeseen breach or audit occurs, the consequences can be significant. For example, consider an organization using an outdated EHR system. Without the latest security patches or encryption, that system could be exploited by hackers who are aware of the specific vulnerabilities associated with that old software. A breach of this nature might expose thousands of patient records, leading to not only regulatory penalties under HIPAA, but also a loss of trust from patients and partners. Alternatively, an organization that still uses paper charts faces risks of misfiling, unauthorized viewing, or even physical damage to the information from events like fires or floods. Paper records can also be left in public areas or disposed of improperly, and unlike digital records, once they're lost or exposed, there is very little you can do to recover control over them. Now, when it comes to HIPAA compliance, the challenges posed by legacy systems are significant. HIPAA's security rule requires that all electronic protected health information, or EPHI, be safeguarded through a combination of administrative, physical, and technical measures. This means that every system, regardless of age, must be subject to regular risk analyses and updated security protocols. Unpatched software or devices that can't log access properly do not meet these standards. Likewise, the HIPAA privacy rule mandates that patient information, whether in electronic or paper form, is protected from unauthorized access. An audit may look at everything from the encryption on your servers to how securely your paper records are stored, and any gaps can lead to serious consequences. A typical HIPAA audit would check if an organization has an updated risk analysis that covers all systems. Auditors might probe the security of legacy systems by asking whether they are isolated from newer, more secure parts of the network, or whether there are compensating controls in place. They may also review policies for handling paper records, ensuring that storage areas are locked, that there are clear guidelines for document disposal, and that staff are trained to handle PHI carefully. The emphasis isn't only on whether the technology is current, but whether the organization has taken steps to secure whatever systems remain in use. In this way, even if a hospital still runs on an outdated system, demonstrating that the risk has been mitigated through additional controls can be an important factor in maintaining compliance. So what can be done? The first step is always to take stock of your current systems and processes. Make a comprehensive list of all legacy technologies in use, whether they are digital systems that need an upgrade or paper records that should be digitized. Conduct a risk assessment to identify where the vulnerabilities lie. Once you have a clear picture, you can begin planning a phased modernization strategy. This doesn't necessarily mean that every old system needs to be replaced overnight. Instead, prioritize your high-risk areas first. For example, if you are still using an outdated EHR, you might start by isolating it from the rest of your network and implementing stronger firewall rules, or even moving to a cloud-based solution that automatically handles updates and backups. For organizations that rely heavily on paper, consider gradual steps toward digitization. Even simple measures like scanning documents and storing them securely can reduce the risks associated with paper records. In addition to technology upgrades, establishing clear policies and regular training for staff is crucial. Everyone, from clinicians to administrative personnel, needs to understand the importance of safeguarding patient data, whether it's stored digitally or on paper. Regular training sessions can help reinforce these best practices, such as checking fax numbers before sending sensitive information, or making sure that paper files are always locked when not in use. There are also practical workarounds for bridging the gap between legacy systems and modern security requirements. In some cases, extended support contracts may be available from vendors for older software, providing critical patches even after the official end of life. Where that isn't an option, implementing compensating controls, such as network segmentation or enhanced monitoring, can reduce the risk. These measures might include isolating an outdated system on its own network segment so that, if it is compromised, the damage is contained. It also means setting up robust logging systems. Even if the legacy system itself doesn't support modern audit trails, external tools can sometimes be used to capture user activity and flag anomalies. Now, one of the most exciting developments in this area is the growing role of artificial intelligence in modernizing legacy processes. AI is beginning to transform how healthcare organizations handle tasks that were traditionally very manual. Take documentation, for example. AI-powered tools are now available that can transcribe doctor-patient conversations and automatically populate electronic records, reducing the reliance on handwritten notes or manual data entry. These tools not only speed up the process, but also help minimize errors and improve the consistency of patient records. In the realm of paper-based systems, AI-driven scanning and optical character recognition, or OCR technology, can convert stacks of paper records into digital files that are easier to secure, search, and manage. By automating the digitization of old documents, AI helps to move organizations away from paper without disrupting the day-to-day operations. Now, beyond documentation, AI is also being used to enhance overall data management and interoperability. In many healthcare settings, legacy systems do not communicate well with the newer technologies, but AI can act as a bridge, translating data from an old format into one that modern systems can understand. This not only improves the flow of information, but also ensures that critical patient data isn't trapped in a system that can't be updated or integrated with current security measures. Over time, these AI-driven solutions may even make it feasible to retire entire legacy systems, reducing your risk and simplifying compliance. Now, there is no one-size-fits-all solution when it comes to modernizing legacy systems in healthcare, and every organization faces its own unique challenges. Some may have the budget to invest in new technology right away, while others may need to take a more gradual approach. The key is to start by identifying where the vulnerabilities are, and then to implement measures, both technological and procedural, that can protect patient data while you work toward long-term modernization. Whether it is through upgrading software, improving physical security, or leveraging the latest advances in AI, every step forward helps reduce the risk of a breach and ensures that patient care remains uncompromised. To sum it up, legacy systems, whether they are outdated electronic tools or paper-based processes, create real challenges in today's healthcare environment. They can be a weak link in your cybersecurity and compliance efforts if not properly managed. But there are effective, practical strategies to address these issues. By taking a hard look at your current systems, assessing the risk, and planning a phased modernization approach, you can protect sensitive data and meet HIPAA requirements, even if you're working with technology that is a bit past its prime. Remember, in a world where cyber threats and regulatory pressures are increasing, every step you take to modernize the old systems is a step toward a safer, more secure healthcare environment. Thank you for listening. Hopefully these insights offer some practical ideas on how you can safeguard your organization while still honoring the legacy systems that have supported you for so long. Stay vigilant, keep updating, and take each improvement as a win for patient safety and compliance. We'll see you next time.